The Pan American Health Organization and the World Health Organization recently reported that the leading cause of death of 29% of persons between the ages of 20 to 59 in the Turks and Caicos is HIV and AIDS. During 2008 and 2009, the cumulative totals of HIV/AIDS cases reported in the TCI were 535 and 554 respectively. Of this number, 74 and 83 received treatment in the TCI primary healthcare system in 2008 and 2009. The number of HIV/AIDS deaths recorded in TCI seems to be an increase, with only 2 deaths recorded in 2006, 1 in 2007, 4 in 2008, and 5 in 2009. Now the National AIDS Department is on a mission to measure the current impact of HIV and AIDS prevention as they are conducting a knowledge, attitudes, practices, and behavior study throughout the Turks and Caicos. The last study of this kind was done in 1990. National AIDS Coordinator Aldora Robinson explains.
We would like to assess the knowledge, attitudes, practices, and behavior of persons within the Turks and Caicos Islands. And as you know, it is critical to the National AIDS Program to halt the spread of HIV. And in order to do that, we need to assess behavior. And in order to assess behavior, hence the survey. Persons have been trained within the department, and a few persons that work within the medical profession and some NGOs to conduct interviews. So we have persons out in the field knocking on doors and interviewing persons within households.
Robinson added that confidentiality is key to the National AIDS Department's work.
So each of them have a contract with us and a commitment to confidentiality. That is one. And two, the interviewees, they're not asked to put their names, addresses, or anything that can identify them.
We also spoke with one interviewer, clinical nurse Iona Glinton, who was excited about the new initiative.
It's pretty exciting. We're working in groups of 4, and the people are very, how do I say it? They're happy to do the questionnaires, most of them, the majority of the people. You would find a few of them that have difficulties in answering personal questions, but the majority of them, for example, one house that I went to yesterday, he was happy to have me because he said he had questions of his own. And he said the last questionnaire that was at his house, it was the census. So he's happy to know about the National AIDS Program and how we're doing this questionnaire to more enhance his knowledge about what's going on around him.
For WIV4 News, I'm Takara Bain.